Prior to 2008 or so, we were receiving about an average of $1 million a year. Our average gift is around $250, so that's a lot of gifts. The program was gaining some momentum, and then with the Save the Hospital initiative, it kind of waned a little. We were probably up to around 800 donors, dropped back to around 500, but we're seeing momentum again. I think the measure of any development program growth is number of gifts and number of donors. And so, and I don't think people make gifts to any organization, but especially the hospital, for a tax deduction. They do it because they believe in the mission. They believe that it's important to have health care here. And we have, this emergency department. We have all the support services like radiology and lab and surgery and, all of those things. And if the community wants the hospital to thrive and be here, they need to use it, and they need to support it with their donations. Little list. So this year we're raising money, in fact $200,000, to purchase all new arthroscopic and laparoscopic equipment for the OR. I think in the last year and a half we've put, $500,000, $600,000, $700,000 into upgrading the equipment and the facilities in the operating room. And this equipment is used by all 8 or 9 of our surgeons, whether they're a foot doctor, a general surgeon, an OBGYN. Every one of them uses this equipment because it allows the physicians to do 3 small incisions, and it's much less traumatic for the patient. The infection rates are much lower. Patients recuperate faster, and the equipment we have is about 10 years old. So we're going to be raising money for all new equipment again for the OR because we need it. I think people really understand that the hospital is very important to the community and to them and to us, and they've always supported it since 1930s. In the early 1930s, women walked the streets of Chestertown with buckets collecting change to start this hospital. And since it opened in 1935, the community has continued to support it, and I'd like to think that will continue and grow.